No pain, no gain. Pain neuroscience facts. Several studies have shown that knowing about pain can reduce the severity of your pain experience. Pain scientists call it as therapeutic neuroscience education. You do salivate when you cross the KFC, the smell of the chicken. Or just think of your favorite food, your mouth starts watering, right? Or just think of someone whom you love, what sensation you feel in your body. Or just think of your boss, what you feel. All these experiences are produced by the brain. Similarly, pain is one such experience produced by the brain. What we know about pain in the past 15 to 20 years is totally new as compared to what is known a few hundred years ago. A lot of we used to believe about pain is no longer acceptable as true. This could explain why some of the pain management strategies that you have tried in the past don't work. So here are the pain neuroscience facts which you must be aware of to kickstart your journey in dealing with chronic pain. I am Rafi Ahmed, physical therapist specialized in chronic pain management. It is difficult to make people accept that their pain is in their brain. Of course, you need patience, persistence, and willingness to learn why you hurt. A few of my patients and healthcare professionals even find it difficult to accept. If you do not accept now, you may have to accept in the near future. Neuroscience Fact 1. Pain is normal, personal, and always real. Pain is designed to protect us, helps us to survive. If you come in contact with a hot stove or a burner or you move away from it, you have an ankle sprain, you rest, allowing the tissues to heal. So, pain is basically designed to protect us, and your pain is 100% real. Even it's chronic. Of course, no one around you can understand your pain. Neuroscience Fact 2. Pain and tissue damage rarely relate. I will start with the story of a British construction worker. This was published in the British Medical Journal in the year 1995. The worker had an accident in which a 7-inch nail pierced through his boot. He was in so much agony. Even the smallest movement of the nail was painful. He has to be sedated with fentanyl and midazolam. When the doctors removed the boot, they found the nail has passed between his toes. There was zero damage to his foot. So his brain has perceived this situation as extremely dangerous and produced pain. His pain was real. In another example, in a military field hospital during World War II, a young doctor named Henry Beecher found himself in a desperate situation. He had run out of morphine and needed to perform surgery on a badly wounded soldier. What happened next was, without hesitation, one of the nurses filled a syringe with saline solution and gave the soldier a shot. The soldier calmed down and Beecher went ahead with the operation without anesthesia. Just a saline injection was enough to sedate the patient. This is the power of placebo. Later, he did a lot of researches on this placebo effect. Phantom pain. You might be aware of phantom pain, where people report pain in the missing part of the limb like wrist or an ankle. How does this happen? Because the virtual limb in the brain is still producing pain, even the actual limb is not there. It is missing, right? This study in 2015 shows that people with severe disc degeneration, bulge, and even protrusion, as seen on X rays and MRIs, have no pain at all. Let's have another example. Just imagine you have sprained your ankle, you are sitting and watching television, you feel pain in the ankle and need help even to go to the bathroom. If suddenly a lion enters the room, you just try to jump out of the window and escape, right? You don't feel any pain at that moment. Our pain system is sophisticated. It uses all the information around you to decide to produce pain. It has a command center in the brain. Pain is not necessarily processed in the location of the body part where you feel it. It is processed in the brain and the nervous system. Pain is associated with tissue damage, but a large portion of the chronic pain doesn't involve tissue damage in the body at all. For example, migraines, fibromyalgia syndrome, chronic fatigue syndrome, there is no tissue damage at all, but you experience severe pain. That's why even sometimes after disc surgeries or total knee replacements, people get little or no pain relief. Your brain may produce pain when there is no tissue damage, like in the case of migraines, or in the presence of tissue damage, like the lion in the room example, the brain may decide not to produce pain at all, which is best for your survival. And the next neuroscience fact, often difficult to agree with, is there are danger sensors, not pain sensors. There is no such thing as joint pain, muscle pain, or nerve pain, and no such thing as pain endings, pain pathways, as we studied earlier. For example, a paper cut in a finger can produce agony in some people, whereas you have an ankle injured badly in a football game and you have to score the winning goal for your team and you made it. Similarly, in the lion in the room example, brain doesn't produce pain because the brain has decided producing pain at this situation is not appropriate for your survival. So, inflamed joints, muscles, and nerves can only send danger signals to the brain, not pain signals. It is up to the brain to decide whether the information coming up is worth producing pain or not. The brain is the boss always. We are bioplastic. It was thought that when you reach adolescence, your brain stops changing. Modern imaging technology is allowing researchers to look into the brain. They have been able to see that you can change your structure, function, and your brain chemistry. This is called neuroplasticity. Your brain can be rewired. In people with chronic pain, the nervous system has often reprogrammed itself to a hypersensitive, overprotective setting, which means it produces increasingly painful response to fairly normal stresses and stimuli over time. This study shows that chronic pain reduces the volume of gray matter in our brains. As a result, chronic pain patients can have problems with memory processing, learning new things. This sounds really scary, but don't worry, this doesn't mean your brain is permanently damaged. The brain and nervous system can always be reprogrammed. So even though changes have already taken place in the brain as pain becomes chronic, many of these changes can be reversed and sometimes completely. A September 2021 study published in JAMA Psychiatry shows that after 4 weeks of pain reprocessing therapy, 66% of people had substantial reductions in brain activity associated with pain processing. According to Lorimer, mostly each and every cell of our body is changing continuously. This is called bioplasticity, which led you to the pain state. And it is the same bioplasticity which can get you out of pain too. And chronic pain is the darker side of bioplasticity. There are techniques to calm down your brain's fear response during a flare up. So, pain treatments are focused on changing the neural pathways in the brain, alter the structure and function of the brain. So, we are bioplastic. Our brains are changeable, and so pain. Pain is treatable. Learning about pain can help individual and society. Research shows that knowing more about pain and how it works leads to lower pain intensity, increased movement and exercise, and improved quality of life. Knowledge is your power. It is the therapy for pain. Neuroscientists call it as therapeutic neuroscience education. It decreases pain by reducing anxiety and fear. When you understand that the pain is not in your back or neck or knee and it is mainly due to the sensitive nervous system, you start moving, and that is pain neuroscience education. Active treatment strategies promote recovery. Once you understand pain, you make plans, you calm the nervous system, explore ways to move, and live a meaningful life. You take charge of your pain and let pain do not rule you. To get rid of pain, treat the brain. It may be difficult but not impossible. Treatment is focused on changing the neural pathways in the brain. Of course, you require patience and persistence in your road to recovery. There is life after pain. You can discover the best version of yourself. These scientific facts are supported by International Association of the Study of Pain, the Australian Pain Society, APTA, the American Physical Therapy Association, and so many international organizations. So if you like this video, hit the like button and share this with your family and friends. To know more about pain neuroscience education and chronic pain management, subscribe this channel, Mind Over Movement. With this, I'm signing off. Thank you.